What if I told you that in your home, your school, or your workplace, the air you breathe could cause lung cancer and significantly affect your health and your loved ones? And what if I told you that this danger is here in many homes and buildings throughout the Lehigh Valley? Scary, right? But before you panic, I'm happy to tell you that this is a danger you can test for and mitigate if needed, thus decreasing your exposure and risk. Today, I'll be sharing what I've learned about the environmental hazard radon, which is found at extremely high levels here in the Lehigh Valley. So first of all, what is radon? Radon is a colorless, odorless gas that comes from the decay of natural elements beneath the ground, mainly from uranium. What happens when you breathe in radon? Well, we know that it causes lung cancer. When radon particles are inhaled, they enter the lungs and emit ionizing radiation. Radon is the second leading cause of lung cancer deaths in the United States, only second to smoking. Who does radon affect? Radon hurts everyone, but it hurts children and pets more because they have faster respiration rates. Additionally, children are still growing and developing, and this exposure to radon at an early age can cause issues such as cancer in their futures. Radon is high across the state of Pennsylvania, but especially in our area. However, many people are unaware of the dangers radon poses to them. So, how did I get involved in this work? Well, for me, it all started when I was in 7th grade. My family received a letter from the Pennsylvania Department of Environmental Protections, or DEP. The DEP was doing a study of indoor radon levels in the Lehigh Valley. I thought that this was interesting and became curious as to why they were doing such a study, and so I started looking into it. I found out that the highest ever recorded level of radon was in my town, Center Valley. The highest ever recorded level of radon was 6,176 picocuries per liter. To put it into perspective, the Environmental Protection Agency's action level for radon is 4 picocuries per liter. This is the level where the EPA recommends that you mitigate the radon in your home. This level was over 1,500 times higher than the EPA action level. Now, you may be wondering right now, what is a 4 picocuries per liter? 4 picocuries per liter is equivalent to the cancer risk of smoking 8 cigarettes a day. And this 6,000 picocuries per liter measurement is equivalent to the cancer risk of smoking over 12,000 cigarettes a day. This helped to put into perspective what the danger radon could pose to young kids and pets. In terms of our community, it made me wonder, what effect was radon having on us over time? What causes cancer? Is it our genetics? The environment? What we eat, drink, and breathe? My own family has not been spared from the devastating effects of cancer. Others around me, in my school, my community, and all around, it seems like everyone knows someone who is battling cancer. Learning more about radon in the Lehigh Valley pushed me towards raising awareness, which I do with my advocacy group, Citizens for Radioactive Radon Reduction. It is hard to do something about a danger you didn't even know exists. Groups that would benefit from improved awareness are homeowners, renters, office workers, as well as schools and daycares. There are large populations in the Lehigh Valley who may be exposed to high levels of radon and may never know it. Within my advocacy group, one of our members, Jackie, developed lung cancer, we believe, due to radon exposure in her rental apartment. She was diagnosed with lung cancer twice, despite being a non-smoker, before learning that her apartment had high levels of radon. Despite undergoing treatment, Jackie works tirelessly to raise awareness and push for change. From our work, I've been asking myself, what is our responsibility to each other? As a society? As a community? As neighbors? Do we have a responsibility to each other? These are the questions that I've grappled with as I learn more and more about the environmental hazard radon, which poses a unique threat to vulnerable populations here in the Lehigh Valley. In addition to raising awareness, I conducted research that looked to see if there is a relationship between the unique geology here in Pennsylvania to the high radon levels. I found that high radon levels are associated with a specific rock type. The presence of sedimentary rock correlates with areas with high indoor radon measurements. This information is useful and can help narrow down the areas that may require testing and mitigation by just looking at a geologic map. As you can see on this map right here, the pink areas signify sedimentary rock, and Northampton and Lehigh County mainly consist of this sedimentary rock. I had the opportunity to present my data to our local state officials. Our state officials were asked to vote on legislation this spring that supports radon testing in schools and daycares, and it was my hope that they would be able to use my data in order to help make a decision. So, as part of the study, I looked to see at the radon levels in Lehigh County, Northampton County, Montgomery, Bucks, and Philadelphia. I found out that the average radon level in Lehigh County is 12 picocuries per liter, and Northampton, where we're sitting, is 10 picocuries per liter. For comparison, Philadelphia's average radon level is 2 picocuries per liter. And as you can see on this map here, the red areas signify places with high indoor radon levels, and the blue signifies where low indoor radon levels are. Our state has the third highest average radon levels in the country after Alaska and South Dakota. Our region, the Lehigh Valley, has higher than average levels of radon. I've learned that requirements for testing vary from state to state. Understanding what other states are doing and sharing this information has been another way that I've been advocating for my state and community. Currently, Pennsylvania does not require radon testing. When I traveled to Harrisburg to lend my voice to support state bills that would require radon testing in schools and daycares, I had the opportunity to share my data with our local state officials. I've worked with amazing people who have worked tirelessly to try to make our community safer for everyone. How often do you think about the air you breathe in your home, your school, your workplace? It is easy to take for granted that the air we breathe is safe. And while the air we breathe is safe for many of us, for others, the air they breathe can cause cancer. The geology here in the Lehigh Valley is unique, but that is only part of the story. We already know that the radon levels here can reach extraordinarily dangerous levels. The other part of the story is, are we willing to let others be exposed to this deadly carcinogen? In most cases, it is the vulnerable that is disproportionately affected. In the Lehigh Valley, children spend over 1,000 hours in schools and daycares that may have high levels of radon. Lower income families and renters frequently live years in the same homes and buildings that are never tested for radon. So, this brings me back to my original question. What is our responsibility to each other? Can we work together to ensure that the air we breathe is safe? Thank you for listening.